think of a child standing on the side of the road in Mumbai. Let's think what the next hour of that child's life is going to be. That child is standing there, breathing air which is deeply polluting, crossing roads which are deeply dangerous.
Considering the devastating effects of air pollution as well as road traffic and the impact that it's had on our children, we need to actually put these policies in place, and we need to actually do the work and ensure that our children are protected and are safe.
So the report that we've launched today, Unfinished Journey, looks at the health impact of traffic on children and adolescents, and it looks at the global health community's response to that. So what we're seeing at the moment is a real fatal disconnect in public health. So in the UN's own Every Woman, Every Child health strategy, which is the main health strategy for improving child health for the Sustainable Development Goals, road injury is mentioned. It's described as the leading cause of death for adolescents. Air pollution is mentioned, but there's no action plan. There's no funding allocated. There's no follow-through. Nobody's being held accountable for this inaction. What we're calling for is a UN summit to meet at the highest level so that we have some coordination. We can integrate this into the Sustainable Development Goals key agenda for child and adolescent health.
When you realise that the leading cause of death for children and adolescents across the world is road traffic, I think that is a truly shocking statistic. And that's happening as a result both of direct accidents and as a result of air pollution, much of which is caused by road traffic. And so when you see the figures, 350,000 children and young people dying on the streets of the world every year, if that was an illness or an epidemic, we would have urgent meetings, we would have summits, there would be real action.
Mr. President.
I've just heard that there's a call for a high-level UN meeting on children and adolescents and traffic, both from an injury perspective and a pollution perspective. And as UNICEF, we'd really like to welcome this chance actually to embrace this and actually get us on the larger agenda. The 500 kids that die per day, but that's the tip of the iceberg, because it's the many more children who get maimed or who lose their dad and fall out of school because of poverty. So that's the bigger burden, I would say, even than the tragic loss of 500 kids per day.
Children are much more vulnerable to pollution than we adults are, so we should make sure that the road from home to school is safe, safe from accidents and safe from pollution.
And if you want to find practical solutions to problems and risks that are facing children in some of the poorest countries in the world, there's no better starting place than listening to children themselves. Now is the time for their governments to listen to them, for aid donors to listen to them, and for international financial institutions to listen to them. Now, if we convene the UN Summit on Child and Adolescent Health, that will be an opportunity to listen to children and put in place the resources and the strategies that can make the world safer and better for them.
Now we have this new UN fund which has been established. The FIA Foundation has pledged $10 million towards it to help give it a kickstart. But we haven't seen any other serious donors coming forward yet. And this is a perfect example of where we now have a vehicle for action which is supported at the highest levels within the UN, which governments are saying is a good thing and have endorsed in the UN resolution, but they need to come forward and they need to give support to it.
But these things need to be resourced. No point just having a meeting. This needs to be resourced, and so the new fund, for example, is important in this regard.
The Child Health Initiative and many other partners have worked together to call for action for better protection of pedestrians in general, and particularly children, and this is slowly but surely catching on and showing results. They don't get enough attention, as many other health issues around child and adolescent health, and therefore having a summit looking at how we can accelerate action to protect our children is very important.
I really hope that the UN Road Safety Fund will attract the civil society and the member states to participate. I'm optimistic that by keeping this effort, we will be able to finally get to the results that we are all working for. Road fatalities is not something which is normal, it's not acceptable. Every day, 3,500 people lose their life on the roads, and about 140,000 people are severely injured, and it has to stop.
In terms of generating action in this area, I want to pay special tribute to the Child Health Initiative, because it's down to their work really that we are now seeing a little bit of momentum growing around the idea of a UN Special Summit. I think that is the kind of action that we need to get people around the table with a good degree of urgency and a real commitment to action. That is how we're going to really be able to tackle this problem.